because it would be very difficult to reopen and then shut everything down again. So, that's something I'm sure you guys are considering when you're reopening, is planning how we would scale back in some capacity.
I think we as an organization and as a country and honestly as a world have learned a lot from this pandemic. I think appropriately so in the very beginning. We didn't have 3 months worth of PPE on hand. We were short supplied and having to gown up and gown down and mask off and so much more frequently. We burned through our supplies. Everybody was clamoring for it. Manufacturing plants in China were shut down, and so we appropriately, I think, closed or limited services just because we couldn't safely keep them operational. Now that we have this surplus, we've really cut our teeth as a leadership of how to respond to these. Just turning off light switches on and off on, again, essential services like healthcare can be dangerous, right? And so we're able now, I think, as a surge comes, if it comes, to really assess it on a case-by-case, a service line basis, dial up and down with more specificity to maintain essential services for the community and do it in a responsible way versus just shutting down a service and sending staff home. And because to your point, it takes a lot of work to get those back online. A lot of things have to hit at the same time to open up on a day. Housekeeping, and you think about all the service lines that support surgery. It was a mammoth effort to get that all back online on one day, get anesthesia back, right? Get surgeons back, open up block schedules, call patients, get them scheduled, get them tested 72 hours before. And it's just was a massive undertaking, and we've done it, and we'll be very cautious in terms of shutting things down again, and I don't think we need to. Honestly, we just need to be very intentional and precise.